Dr. Zainulabedin Hamdulay, MCH, Thoracic Surgery, MS General Surgery, DNB, Cardiothoracic Surgery, Director and Chairman, Chief Consultant for Cardiovascular Thoracic Surgery, Masina Heart Institute, Mumbai. Dr. Hamdulay, it has been observed that patients with COVID are more prone to cardiac ailments. Cardiomyopathy and cardiac failure are also quite common in such patients. Why does this happen, and what steps can they take to prevent this?
So COVID-19 is primarily a lung problem, but it has been seen that it can affect heart also. Now, the affection can be either direct or indirect. Direct in the sense that it causes myocarditis or inflammation of the muscles of the heart, resulting into weakening of the muscles of the, and indirectly by affecting the lungs, which will result into decrease in the oxygen level of oxygenation of the body. And the heart now has to pump much harder to supply the body with same amount of oxygen. Now, patients who have already been cardiac patients, now such hearts cannot cope up with this extra load and can end up into heart failure. Also, we have seen that in COVID-19 patient, there is high propensity of blood clot forming into the blood vessel. Now, when these blood clots are forming in blood vessels, a patient can get heart attack. That means when the heart attack happens, the heart muscle die, and this can result into permanent damage of the heart muscle. So all these patients, if we don't take care, can end up into heart failure or chronic heart failure as we call. These patients need to approach their doctor because we need to start the treatment as soon as possible.
Now, Dr. Hamdulay, lockdown has disrupted the routine of people. You know, over this last year and a half, people have missed routine blood tests, in fact, and other health-related tests. Can you please advise patients which tests should people do regularly to keep a check on their heart health?
So as pandemic is settling and we are all getting back to our routine, so I would advise all those patients who have been affected by COVID-19 to approach their doctor and get them investigated. Now, it's important that they have a complete heart checkup because it has been seen, as we all know, that COVID-19 has been affecting even heart. So we get our ECG done, stress test, 2D echo, cholesterol level, and BNP as we call, which will give us the status of the heart. Based on the information, then we can diagnose whether the damage that has happened because of COVID-19 was temporary or it is permanent. And if it is permanent, then the physician will start you on treatment immediately.
Dr. Hamdulay, how can you define an elective surgery in the field of cardiology? Are all heart surgeries essential and on emergency basis, in a few cases that we can wait till the pandemic condition improves? Because, you know, over the last year and a half, a lot of people have put off surgeries that were required of them. What would you advise them?
So no cardiac problem can be ignored. It will take hardly any time from elective to somebody to become an emergency patient. So what is important is to get yourself checked by a doctor. He will define whether your problem is, it can be medically managed or it needs an intervention. If doctor decides that this can be medically managed, then it's better to postpone the surgical intervention till this pandemic is over. But in case if he suggests that this has to be addressed as soon as possible, then there is no time in wasting and no time to ignore your symptoms. I would suggest them to undergo surgical intervention or any form of intervention, sooner the better.
All right. So always consult your doctor and, don't make any decisions on your own. Let's get another question on cardiac health. And Dr. Hamdulay, many years of scientific studies have shown a close relationship between cardiovascular disease and cholesterol levels. Should one focus on lowering dietary cholesterol or saturated fats?
Yes, there is a connect between your cholesterol level and cardiac disease. There is something called as bad cholesterol and good cholesterol. So all our efforts have to be there to increase our good cholesterol and decrease our bad cholesterol. How? I would suggest that we have a proper diet charts. We approach a dietitian if necessary, and try to cut out our food habits in such a way that we consume food which are good for our heart, which can reduce your bad cholesterol, which is known as LDL or VLDL, and help us to increase our good cholesterol, which is known as a high density lipoproteins.